Here's the case of an 18-year-old pitcher with right knee patella tendinosis going on for quite some time, did not respond well to physical therapy. I'm going to walk you through a platelet-rich plasma injection / tenotomy of the proximal patella tendon using ultrasound guidance. So here's a gross depiction of the procedure where you can see the syringe going just superficial to the patella tendon and injecting some platelet-rich plasma just superficial to the tendon. And here we are beginning the needle fenestration of the patella tendon to try to elicit bleeding and mechanically irritate the tendon to try to again stimulate it to heal. And you really have to do this many times to pass in and out of the tendon, again to mechanically just irritate it and make it bleed. And also we're trying to cover the medial and lateral aspect of the tendon during this fenestration. And here we are injecting PRP into the tendon itself. Here's a normal patella tendon. You can see how thin it is. And here's the Hoffa's fat pad just underneath it. It's nice and white. And here's our tendinotic tendon, which is thickened proximally and red, consistent with tendinosis. Again, here's that thickened tendinotic part of this patella tendon. And here we are going to the posterior part of the tendon, which also has somewhat of a globular type of thickness to it, consistent with tendinosis. And here are the bursa in the region of interest. We have the prepatellar bursa, we have the deep infrapatellar bursa, and we have the subcutaneous infrapatellar bursa. Here we're looking at the deep infrapatellar bursa. And here's our Hoffa's fat pad coming back into play. And now we're essentially going to bring the lower extremity into position for the procedure. So here we are, we're starting with the platelet-rich plasma injection, just superficial to the patella tendon, which you can see here. And now we're starting the needle fenestration. We're making the patella tendon somewhat translucent so we can get a better sense of exactly where our needle is going. And we're trying to cover both the medial and lateral aspect of the patella tendon with our fenestration. And here we are injecting the patella tendon itself with platelet-rich plasma. So this is our patient, 18-year-old male, persistent patella tendinosis in the proximal patella tendon on the right side. He's a pitcher, just doing a lot of squats prior to his pain starting. Basically his pain to palpation right over the proximal patella tendon. We're going to go ahead and do a platelet-rich plasma injection. He didn't really do well with eccentric type exercises and physical therapy. So here's a sagittal view of the knee. You can see the patella with his patella tendon attaching to it. Not very impressive overall. You can see Hoffa's fat pad right underneath the patella tendon. Normal thickness of his hyaline cartilage on the lateral femoral condyle. And here's our axial view. Right side of the screen is medial, starting off with the patella and going distally. And looking at that patella tendon, you can see both femoral condyles, which look normal. And what's interesting here is you can see the medial part of the patella tendon is somewhat thickened, consistent with tendinosis as compared to the lateral aspect of the patella tendon. And I believe this finding is consistent with this clinical picture. It's not very obvious, but I think it's there, and I think it does correlate well. Here we are distally at the tibia tubercle. We see some anisotropy of the patella tendon. And here we are going back proximally. So what we're doing now is just drawing off his plasma. We're not going to use that. This is platelet core plasma. This is a 30 cc kit, so we'll get a little more PRP than our usual 20 cc kit. We're going to mix this up. And here we are, we're just mixing up the PRP and trying to see a little buffy coat, that little white ring around it. And let's go through this a couple of times just to mix it well. So this is a sterile technique, sterile probe cover, sterile gel, sterile drape around the knee, just to keep the whole area sterile. And here's the patella tendon, and PRP being injected just superficial to it. I'm really just bathing now the top of the tendon in it. When I do these PRP shots, I usually inject initially superficial to the tendon, as that is less painful than injecting actually in the tendon itself. And then perhaps towards the end of the procedure, I'll inject intratendon, where I think the symptoms lie. It's also good to do a tenotomy or tendon fenestration during these procedures to mechanically irritate the tendon to elicit bleeding and healing as well. And also this serves as a route for the PRP to seep into the tendon and help it heal. And ultrasound is very useful here because we can direct the needle right to the bone without actually poking into the bone and causing unnecessary discomfort. Okay, so about 5 months PRP injection in the right patella tendon, college baseball player. And how are you doing?
Doing a lot better now. It's feeling a lot better than it was 5 months ago.
Okay, so better in terms of what, like pain with pushing off and pitching, or?
Yeah, there doesn't seem to be any noticeable pain with the activities I was doing. It still does get pretty sore when I run.
Okay, where in that one spot?
Yeah, like right down here.
So when you run, is it still better though when you run?
Yes, it doesn't have that pain that it used to, but
Okay.
it just gets a little sore, and I've also noticed I still can't really do like squats without
Some pain.
any pain, so I kind of just stop.
How much pain do you have when you do your squat?
Say after a couple sets, it gets to like a 6 or 7 maybe.
After a couple sets, okay. But the main pain was with pitching, right? That's your push-off leg?
Yes.
And how much of that pain has gone away?
I don't notice it at all.
So that was your main complaint before?
Mm-hmm.
Okay. I mean, so overall, I mean, how much improvement do you think you got from the PRP? Let's say 100% is complete removal of all your pain, which is not going on.
Mm-hmm.
You know, 80% overall, 50% overall.
I'd say like 80, 85.
85, so pretty good. That's a pretty good result. And do you feel like it's wearing off, or it's kind of maintaining itself?
I think it's maintaining itself.
Okay.
I haven't noticed any drop-offs or it getting worse at any point.
Okay. All right, great.